Mark, U.S. lawmakers have passed a bill that will allocate more than $8 billion for control and prevention of the outbreak. Tell us more about the exact distribution of this large amount of money and specific measures.
Well, that's right. A surprising admission from the Trump administration during a visit to 3M plant in Minneapolis that makes medical supplies and masks. Vice President Pence said, "We don't have enough tests today to meet what we anticipate the demand is going forward." But he went on to say, "We want to make sure they have access to a coronavirus test, and we've made real progress in that in the last several days." Certainly a spin on a worrisome admission, especially when the U.S. has seen a surge in cases, now around 200 cases, at least 12 deaths. The Union for the National Nurses United highlighted the situation when they revealed a survey of 6,500 nurses. 44% said their employer had not provided information about how to identify and respond to potential cases of the virus. But some progress, as you mentioned, being made in the Senate, which passed an emergency $8.3 billion spending bill to combat COVID-19. President Trump is expected to sign the agreement, which far surpasses the administration's original plan to spend just $2.5 billion. Of course, money will go to vaccine development and also testing kits. Panda.
So, Mark, talking about where you are right now, San Francisco, there is an upcoming huge challenge. That is the cruise liner Grand Princess. It's been held off the coast of San Francisco right now of the fears of an outbreak on board. So, what are the measures in place to prevent that from happening?
That's right. I'm actually at the pier where most of those the Princess cruises take off from here. We don't know yet when that ship will come in. They're still doing tests right now. Ironically, I heard just within the last 2 hours that there was a case in Silicon Valley about an hour from here where an elderly man, a 72-year-old man, was unconscious. Police responded to that case and did CPR, not mouth-to-mouth though. That man died, and then his family later said that man had been on a cruise where there were 2 people that had coronavirus. They haven't confirmed that coronavirus, but another case that is being worrisome and being followed up. Now, the state of California has declared a state of emergency, but that's more to put in line resources to procure equipment and services and share information on patients. But an even more troublesome situation is that cruise ship that is out there on the waters now. They've sent out testing kits to test them. That's a situation that is closely being monitored.
San Francisco officials announced the city's first 2 cases of COVID-19, a woman in her 40s in fair condition and a man in his 90s in serious condition.
These cases are like similar cases we are seeing in the region. They are indicative of community transmission of COVID-19.
But the city has an even bigger crisis in nearby waters. The Grand Princess cruise ship is currently waiting in limbo off the California coast with suspected cases of COVID-19 on board. Earlier, via helicopter, the U.S. Coast Guard airdropped test kits onto the ship. The testing samples are being sent to a nearby lab in Northern California.
The CDC, the California State Health Department, and the Governor's Office of Emergency Services with the U.S. Coast Guard are working to determine if COVID-19 is present on the ship.
Amid reports of racist incidents across the country, San Francisco's mayor made a plea for unity.
When there is a stigma attached to a particular group of people, especially around such an important public health issue, then it's less likely that people will be willing to come forward, which means that the health outcomes we need to address this virus may not occur.
San Francisco's director of health also stressed that discrimination was unacceptable, noting that the virus does not discriminate.
Thank you very much, our correspondent Mark New in San Francisco.